District Heights, welcome again. This is Jonathan Medlock, your mayor here in the city of District Heights. I'm here with an awesome young man who has done some great stuff in our community. This is Dr. Chile with MedStar Regional Hospital. He is the Vice President of Medical Affairs, is that correct? With MedStar. This young man has done so much. Dr. Chile, it is an honor to have you here in the city of District Heights. One of the things that I'm making happen now, especially in the world of COVID and what's happened, is a Healthy Heights initiative. We need to raise the health barometer of the city of District Heights and those around it. We need to start with our city first, and to have you here as a medical professional and to talk about that and what that means as far as getting our lives together in the midst of what's happening now is so very important. So one of the things I want to do, and I want the city to get to know you and who you are. Can you give me some background about yourself and who you are?
Sure. Well, firstly, thank you so much, Mayor Medlock, for having me here. I'm really excited to be part of this community, to be part of MedStar Health. And you know, I am a urologist by training, so that's my background. Urologists are surgeons that focus on men's health and the male reproductive organs. That's sort of my specialty area. But I have, over the last 25 years, focused on overall men's health. So, you know, things like diabetes, heart disease, hypertension, everything that affects men, and particularly with a focus on African American men and some of the disparities that we see among African American men. I started off in academics at Howard University, and again practiced as a urologist there for many years as a professor, and then I transitioned to MedStar Health as an executive, as a healthcare executive, and so as you mentioned, the Vice President for Medical Affairs at MedStar Southern Hospital Center, right here, right down the street in Clinton, Maryland.
Absolutely.
Yeah.
That is awesome. A wealth of experience and knowledge, and this is what we want to bring to the residents and to those who will be watching. This broadcast not only goes out to the District Heights, but to Prince George's County, Montgomery County, certain areas of all of Maryland. So we want people to see this information coming from the experts and letting them know what needs to be done in this time of wanting, in a sense. So what do you think is the importance of bringing awareness to men's health, especially during this pandemic?
Yeah, thank you, Mayor, for bringing that up. I think if there's one message that I'd love to resonate for the audience today is that despite the challenges of a once-in-a-lifetime global pandemic, we have to get back to focusing on maintenance preventative health care. So, you know, those regular visits to the doctor or to your trusted healthcare provider, where you can get your blood pressure checked, where you can get your blood sugar checked, where you can get your prostate checked. All of those things are critical, because although the pandemic has in many ways set us back in terms of general health, we're still, our bodies are still, our health, our life is still progressing, and so health and sickness is still progressing. And so it's really important for us to continue to focus on preventative maintenance, just like you know, a car or a plane or any other high-functioning machine. We absolutely have to get back to the practice of seeing our doctors on a regular basis and checking things out, especially if they're not having symptoms.
Is there an age that you recommend, or that is stated that men need to go get their prostate examined? Is there an age? Or?
Absolutely. So the American Urologic Association, as well as the American Cancer Society, have put out recommendations for individuals who are what we call low risk for prostate cancer, and I'll tell you about the high risk population. But if you're not at high risk for prostate cancer, it is recommended that you begin prostate cancer screening at about the age of 55. But if you are at higher risk, and high risk is if you have a family member, a first-degree family member who's been diagnosed with prostate cancer, or if you are of African origin, particularly African Americans, getting screened at an earlier age is probably a good idea. And so that age would probably be around 45.
Okay. Wow. Okay, so that is extremely important information to know. But a lot of us, as you know, a lot of men, for whatever reason, don't take care of themselves as they should. What if men don't have primary care physicians? What should they do, and how do they make that happen? Because a lot of times it's based on fear. They don't want to be told bad news, so they don't go do it until it's too late. So how do we change that paradigm, and what do they do? So
that's the million-dollar question. Yeah. So how do we engage our communities in a change in health-seeking behavior? And I think it's going to be based on our relationships with our families, our friends, our communities. So church, many faith-based organizations have health and wellness programs, and you can get plugged into trusted healthcare providers through that. Often talking to friends about their experience with health. Family members, our wives will definitely get us to go see the doctor if it's needed. So I think that, and then conversations like this, talking about it and emphasizing the importance that even if you feel like $1 million, there could be things that are going on in our bodies that have not manifested, and it's not a good idea to wait until you start feeling bad, because a lot of times some of the treatments don't work as well if you wait until you become symptomatic. Especially things when we talk about blood pressure, the silent killer. When your blood pressure is high, sometimes the first symptom you have is when you're having a heart attack or a stroke, or when your kidneys are starting to fail.
Wow.
So it is really important to take that proactive approach to health by getting checked out on a regular basis. And that can be sometimes challenging, especially like in a pandemic like this. It's a little scary thinking about having to go to the doctor, but most healthcare facilities have now come up with good protocols to keep people safe as they go in to get their maintenance.
From once we started, when this pandemic started 17, 18 months ago, yes, the protocols were not there properly, but as things progressed and we've grown to accept where we are, the protocols have definitely increased, and the chances of contracting COVID and everything else is, I think, declining because of the things that are in place. One of the things that I believe Malcolm X said, when I is replaced with we, even illness becomes wellness.
Wow, that's powerful.
Yeah, because we have to understand that, once again, in our conversations earlier, once we come together collectively to say that we will find the solutions to the problem, we will make the changes that we need to see, I think that is the beginning of growth from this, and growth for as a nation. But we have to start with small cities like District Heights in understanding that, the conversations, and we cannot do this without the women who push us to get these things done. I know a lot of my friends and colleagues who are afraid to go to the doctor, but their significant others or their sisters poke and prod them to go to the doctor for those particular things, and it does keep us living, keep us well. So we need to convert the illness to wellness by really doing things like we're doing now, by having the conversation. So I thank you again for that. And that goes to the next question, and the biggest question for me is, how can we take care in this pandemic and what's happening to us now, our mental health? What can we do?
What an important question. Health and well-being starts with the mind, from my perspective, and I think that mental health and well-being in many ways starts with good balance. Work-life balance, they call it, having activities that allow us to emotionally vent, because it's a high-pressured society. That's just the way it is. And so by identifying activities that are important to us, that allow us to reconnect with ourselves in a very intimate way, is one of the basic ways of maintaining mental health. Exercise is a great example of that. Meditation is another great example. Having hobbies that help us to connect with ourselves and connect with our passions. Whether for me it's gardening. I love gardening. Just being out in my backyard, working with the trees and working with the plants. So I think that's where it starts, and then stress reduction. All of that does result in stress reduction, but active steps in being aware when we're in situations where we're chronically stressed, and being able to seek out help and support in trying to de-escalate some of that stress. I think all of that plays a role. But again, preventative maintenance. So those regular visits to our healthcare provider, part of those regular visits are assessing our mental status and understanding where, how much stress that we're going through, and whether or not we're starting to have too much anxiety or too much, or it's early signs of depression, which is very common.
I see so many people dealing with anxiety and depression and these panic disorders. I've received, of course, as mayor, so many calls from residents, and once this pandemic started, going to various communities, neighborhoods, and knocking on each individual door in my community, and seeing a lot of my elders who are dealing with anxiety disorders because they have no one there. They're by themselves, or been widowed, or just before the pandemic it was bad, but now that the pandemic is here, it became worse, and they're living with the overwhelming despair sometimes, and we can't, I guess, say that doing all these things can absolutely mitigate everything. Mm-hmm. There's also, what about medication? Is that important also? Yes, having that balance?
I mean, once you set up that appointment and have a conversation with a trusted healthcare provider, it will be determined whether or not medication is helpful. But there are a lot of conservative approaches to maintaining a good state of mind. You hit on one that I didn't mention, which is super important, and that is isolation. Studies have shown that folks who are not connected to others often have a higher risk of a variety of different mental illnesses, whether it's depression, anxiety, and so having a good network, having a good group of people that you can interact with on a regular basis, whether it's family members or friends, is very helpful. But if you do get to a point where you see a provider who believes that you could benefit from treatment, medical treatment, there are effective medications for treating pretty much all of the mental illnesses that are out there.
But of course, we want to, once again, start the process ourselves, have a bit of self-motion by doing those things, as exercising, gardening, taking those mini vacations, those trips, and doing what we have to do. It starts with us doing what's necessary for us before we get to that point. Sometimes we can let things go so far, even mental health, so far that coming back now, it takes a while. You have to, it's a slow turn of the ship. It is not, it's an immediate right or left turn. So that's very, very important that we do. You mentioned gardening. I have to ask you, what is your favorite plant or flower that you've grown?
I have a sweet bay magnolia tree that is about 35 feet tall. It's one of the largest sweet bay magnolias in the state of Maryland. And with one of the recent storms, the winds actually caused the tree to bend, but not break. Okay. But it took a significant bend, so I had to work with an arborist to get it re-straightened, and so we've been taking good care of it ever since. Wow. So that's been my focus plant for the last couple of months. I love it. But seems to be doing well.
Well, once again, it takes your focus off everything else to take care of something else that is not, that you love and you've cherished and you've grown to that degree. That is awesome, and it's a telling tale of life it didn't break. You know, we are bending in this storm,
That's right.
but we are not broken. And as you're doing with the arborist, you're finding ways to correct and self-correct this thing. And this is what we have to do as a society at this point during COVID. We bend, we don't break.
I took it as my lesson.
It is your lesson. Absolutely. And we should. What is one of the biggest things, what is the biggest risk and challenges that's facing the minority community, especially among men? What's the major health risk that we're facing?
So there's several. I'm glad you brought up that topic. Cardiovascular disease continues to affect African Americans particularly at much higher rates than other ethnic groups, and that includes heart disease, cerebrovascular disease, so strokes, also kidney disease is in higher prevalence, and diabetes. And then for men specifically, prostate cancer. So prostate cancer is still 60% more likely to affect African American men in our lifetime than other ethnic groups. And unfortunately, we still have about a 2 to 3-fold higher death rate associated with prostate cancer. And so prostate cancer is one of those diagnoses that you can get good outcomes with early detection, but you get bad outcomes with late presentation. And the only way you can detect it early is by screening, because in the early stages of prostate cancer, there are no symptoms. So that's, again, that preventative maintenance message that going in on an annual basis, getting your checkup, getting your PSA test is a really important part of keeping your prostate healthy.
Most men talk about when they go to a urologist, and the thing that frightens them the most is the exam itself. They're also, is that the only way, or are there other tests that can be done to make sure whether you have it or not, whether you have polyps or the like? Is a blood test?
So yeah, so PSA, or prostate-specific antigen, is a blood test, and it does not involve the infamous digital rectal examination. However, experts still recommend both the PSA and the DRE together, but PSA can provide valuable information by itself. There are other imaging studies like MRI that are now available that give us some information about the prostate, but that first step is to get in and get your PSA done, and then if you're comfortable with it, the digital rectal examination, which, by the way, is an awkward examination, but it only takes a few moments, and it actually can save your life.
Absolutely. For the sake of our health and well-being, and for our family, we have to move past being uncomfortable for a few seconds in order to be here for our families for a few years. Yes. So I think we need to really focus on that and get our minds right and our bodies right, so we could be here for the loved ones that we cherish. So I think that at the end of the day, we have to focus on what's best and what is right holistically. Once again, we are not in this by ourselves. We have people who rely on us, who love us, who expect us to be here for the long haul. So there is so much more that we can talk about, but the last thing I want to ask is, I see that the new pandemic that will be occurring is the pandemic of mental health disparities, mental health issues within individuals and families. It's something that's being talked about now. But during this pandemic, and this, even after the pandemic ends, will be a long-standing crisis within itself. I've oftentimes talked about going through anxiety and panic disorders and being depressed at points in times, and not having that be a taboo. It is okay. Mental health is health. And what do you think we could do to really hone in on the fact that we can talk about this and we can move forward with mental health and mental health maintenance? It's
a great question, and not sure I'm going to answer it completely, but I can make a couple of comments. At MedStar Southern Hospital Center, we're very committed to mental health disorders. We have an inpatient facility that treats both voluntary and involuntary patients. We have a comprehensive behavioral health unit in our emergency department environment. We also have ambulatory behavioral health services. But to me, the solution to beginning to get our hands wrapped around some of the mental health challenges that we're going to see in our communities is taking it out of the hospital and getting it into the community. We need more community-based resources. The state just awarded our county significant dollars to develop and expand the mobile crisis platform, behavioral health mobile crisis platform in the county. And so that's a good starting point in terms of being able to get to people in crisis in the community, as opposed to having them being brought in to the hospital or through the correctional system or the legal system. I think that's an important part of it. But again, going back to preventative maintenance, I think it's taking down the stigma is going to involve more and more conversations about mental health and about the reality that it's not something that needs to be in the shadows. It's very common. Our society is a stressful society. There are lots of pressures, and our ability to navigate all of that, it varies from person to person. And so that connectedness that we talked about is a big part of this. Being able to have those dialogues, being able to identify resources and identify early signs of mental illness is very important as well. So it's kind of both ends of it. You've got to address the crisis part, and instead of putting people in ambulances and dropping them in the emergency department, we need to be treating their crisis in the community. But then also we need to have more venues for conversations about what does it mean? What are some of the early signs of mental illness? What could be going on in your life that could be triggering these things? And getting comfortable having those conversations. I think that's where the solutions lie.
I think men need to understand you're not weak because you seek help, you're strong because you do.
That's right.
And that is what needs to be relayed to men, because we have this level of expectance and bravado, and you should be strong at every time, you should not cry, you have to be, and we go through that, especially from me being from the South and me having and understanding my African roots. We don't talk about mental health. You deal with it. Mm-hmm. You make it work. And I know in the past, men typically die 15 years before women because of the stress and the amount of pressure that we've always had to deal with. Being the provider, being that part of being a male and societal perspective say we have to be, we don't give ourselves a chance to be human, and to really feel both sides and understand that. So the strength is in the service and servicing yourself, and it's not a weakness, and we have to really throw that and put that out there so people can know that.
You bring up a good point, and that's another reason why it's important to get plugged into a good trusted healthcare provider, especially at an early age. If our men are getting into the habit of seeing a doctor or a healthcare provider on a regular basis, that trust builds, and then if you are experiencing those kinds of symptoms, you're more likely to be able to have that conversation. So that's another benefit.
Good
for
point.
Yeah.
Good point. Familiarity through having that relationship built. Over time, it just doesn't happen. So this is awesome, and it's what we're doing now. We're building relationships. We're starting now. You're not only a doctor. You're not only doing this. You've done this throughout the continent. You've done this in pretty much everywhere overseas. You've done some great mission work in various places, but you're back here doing the work locally because the need is great here also. And we appreciate you coming here, taking the time out to give us some of your perspective. I believe I found a partner and a good friend, because one of the things I cue on before I even meet a person or shake their hands or whatever. It's connecting with their spirit. And you have a great spirit, and that I appreciate.
I feel the same with you.
Yeah, yeah. So in a sense, we say we found our tribe. We found our tribe. So when we find our tribe, we tend to hold on to that because we have a work to do. And that goes back to the purpose we talked about much earlier and previously. But thank you again for coming out and answering these questions for our community. District Heights appreciates you. I appreciate you for coming out. And this is just a start of the conversations that we'll continue to have. But thank you again.
Thank you, Mayor.